Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about stress and anxiety. Now, what is the difference between stress and anxiety? Stress is the emotional strain we feel when a demand is placed on us and we feel we cannot cope. So, it is the imbalance between the demand and the ability to cope. Anxiety, on the other hand, is a feeling of fear, worry, unease, and it's often a reaction to stress. But sometimes in some of the anxiety disorders, the cause of that unease or worry cannot be identified. And this is particularly so in children because they are unable to know the cause and effect or even express their own feelings and concerns. Stress is not always bad. We know that stress helps the child to learn to cope with challenges, avoid dangerous situations, and in fact, it can be a protective and beneficial in a short term. However, when it is persistent and the child feels overwhelmed and it affects his day-to-day activities, then it certainly is not good. Now, some of the normal situations when children do feel anxious is well known. The fear of strangers, which comes at around 9 months in babies, separation anxiety, which is seen at around 18 months in toddlers, and as the child grows older, they may have fears of being accepted, of darkness, of physical harm, of monsters, and of course the need to fit in. But there are other factors which can actually aggravate anxiety because of the stress put on the child. When the curriculum is too much, the school curriculum is too much, or the homework is too much, or our expectations of our children are too high, and the child rushes from one extracurricular activity to another. We forget as parents and caretakers that children can't be good at everything. And then the well-known hurried child syndrome ensues. Other factors in the environment can produce stress in children. Children need a very safe and warm environment to grow in, and if there are marital problems, it can cause a lot of stress and anxiety in the child. Sometimes children don't understand the difference between a fight and just hot discussion and arguments, and it's better to have these behind closed doors because children then become very anxious. There is a very important phenomenon known as behavior inhibition. This is seen in a subset of children who are genetically more prone to anxiety. They react more to stressful situations. They withdraw more quickly. They don't like to go to new situations. Some of your parents may have seen their children behaving like this. They don't like to go to birthday parties. They prefer being on their own. And identifying behavioral inhibition and treating it correctly prevents adult anxiety disorders. So how do we help these children? Instead of pushing them into doing things we think they should be doing, like going down that big slide or going and playing with other children in the playground. Don't push them, don't pressurize them. Do role playing, do rehearsal at home, accept the child's anxieties and gradually give them exposure to the factors or situations which cause anxiety. There are other ways of preventing stress as well. Having a set routine helps children because they know what to expect and so they're less likely to be stressed. Resisting put downs and shaming your child and comparing your children either among siblings or with their friends. And then of course looking for evidence of bullying or learning difficulties. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.